This video will walk you through the application and removal steps for the EO2 OxySpur dressings. The OxySpur dressings are a 4-layer foam dressing with a super absorber to absorb and wick away wound drainage. Continuous diffusion of oxygen therapy combines moist wound therapy with pure oxygen delivery. Our proprietary spur design creates channels within the dressing to allow for even oxygen distribution throughout the wound bed. Both our adhesive and non-adhesive dressings have blue bubbles on the top. This allows the clinician to easily identify the top occlusive layer from the bottom, which touches the wound. The bubbles always face away from the body and should be visible when applied. Here are some quick tips regarding the dressings. Dressing changes depend on the amount of exudate or wound drainage. This can vary from once a week to multiple times a week, but we recommend no more than 3 times per week. Cellular activity will increase once oxygen is being supplied to your wound, so protecting the peri-wound area, the skin on the edges of your wound, is highly recommended. The tubing must be secured to prevent it from being pulled out of the dressing. Secure the tubing by taping a loop onto the top of the foam dressing. Lastly, the extension set, if needed, does not need to be changed unless it is damaged or soiled. OxySpur non-adhesive dressings are recommended in these situations. For patients requiring dressing changes more frequently than 1 to 2 times per week, for those who do not tolerate a hydrocolloid adhesive or have other skin sensitivities, or if the clinician would like a non-adhesive dressing. OxySpur adhesive dressings are recommended in these situations. For patients requiring dressing changes 1 to 2 times per week, or at least 3 to 4 days apart, for the convenience of application, or for wounds in difficult to secure areas. We recommend moist wound healing principles, cleaning of the wound margins, and peri-wound areas, coupled with appropriate debridement approaches. Therefore, prior to application, cleanse the wound and peri-wound areas. A clinician should debride the wound of devitalized tissue such as eschar and slough, as it may interfere with oxygen delivery. Select the dressing size in which the foam will completely cover the wound and extend onto healthy tissue. Use skin protectant on the peri-wound before applying an adhesive dressing. It's important to mention that the use of oil-based products, such as petrolatum, salves, or ointments, is not recommended. These products do not allow oxygen to penetrate and will impair the efficacy of CDO therapy. Gels and creams are typically water-based and work well with CDO. To perform the dressing application, you may need scissors, medical tape, skin prep or barrier cream, your OxySpur dressing, any prescribed compression or offloading garments. The first step in the use of either OxySpur dressing application is the use of a skin protectant before placing the dressing to protect the peri-wound from maceration. For patients that require non-adhesive dressing, follow these steps. Orient the dressing such that the tubing exiting the dressing goes towards the head when the patient is standing or resting. This will help prevent exudate from entering the tubing when the patient removes the oxygenie to shower or bathe. You can cut into the foam to make it easier to go around curved areas, but take care not to cut the tubing, as it could cause the foam layers to separate. This tubing extends into the foam, which you can feel in the center of the dressing. Place the dressing foam side down against the wound. The side with the bubble print should be visible. Once applied to the wound, slight pressure should be placed on the entire dressing to ensure that it contacts the surface of the wound. This enables wicking of excess fluid from the wound bed into the dressing and can be achieved using a wrap or sock. A secondary film dressing, tape, wrap, or conforming bandage should be applied over the OxySpur dressing to secure the dressing in place. To ensure the tubing does not get pulled out of the dressing, it is recommended to make a pigtail loop and secure it on top of the dressing. The seal around the dressing edges does not have to be perfect. However, gaps or tears could allow exudate to damage the peri-wound and potentially lowering oxygen concentration at the wound site. All dressings are suitable for use with compression, from light compression stockings up to 4-layer compression wraps. For patients that require adhesive dressings, follow these steps. The OxySpur adhesive dressings come with a hydrocolloid border. These dressings are recommended for patients needing 1 to 2 dressing changes per week. Follow the same protocols mentioned earlier, such as cleaning and debriding the wound. Protect the peri-wound area with skin prep or barrier cream, as with the non-adhesive application. But in addition, apply a layer of skin prep to the skin, which will be under the hydrocolloid border. Hydrocolloid adhesives work more efficiently when warm, so you may want to warm the adhesive portion with your hands prior to application. To remove the adhesive backing on the bottom of the dressing, stretch the hydrocolloid gently where the clear liner is divided to release the edges of the liner. Remove one piece of the liner to expose the adhesive on the dressing. Orient the dressing such that the tubing exiting the dressing goes towards the head when the patient is standing or resting. Position and smooth into place while removing the second half of the clear plastic liner. Carefully smooth around the edge of the dressing to ensure good contact between the adhesive and the peri-wound skin. Briefly apply pressure to the adhesive border until it becomes firmly attached to the skin. Hydrocolloids activate with heat and pressure. As in the non-adhesive instructions, to ensure the tubing does not get pulled out of the dressing, it is recommended to make a pigtail loop and secure it on top of the dressing. Connect the male lower end of the tubing to the female port labeled O2 on the top right side of the oxygen generator by inserting and turning clockwise until secure. If extra distance is needed between the device and the dressing, an extension set is provided with each box of dressings. Connect the dressing to the extension set by inserting the male end of the OxySpur dressings tubing into the female lure lock fitting of the extension set and turn clockwise until secure. Route the extension set inside clothing and attach it to intact skin with medical tape. Be sure to allow for the tubing to have freedom of movement. Connect the male lure lock fitting of the extension set to the female port labeled O2 on the top right side of the Oxygenie by inserting and turning clockwise until secure. Make sure that all connections are secure so that the oxygen does not leak out. And that's it! Frequency of dressing changes depend on multiple factors, including condition of the wound, level of exudate, and other variables. Dressing changes should be done once wound exudate reaches the top or edges of the dressing, or at minimum once per week. Disconnect the dressing from the extension set or the device. The extension set does not need to be changed unless damaged or soiled. For the non-adhesive dressing removal, gently lift corners of the dressing away from the wound and remove and dispose of the dressing as you would any other dressing. Here are the recommended steps for the OxySpur adhesive dressing removal. OxySpur adhesive dressings are recommended to stay in place for at least 3 and no more than 7 days. To remove the hydrocolloid border, we recommend the use of a medical-grade adhesive remover. Use the remover pad to gently pull up a corner of the hydrocolloid strip on the OxySpur dressing. Loosen the adhesive by using a lateral stretch and the medical adhesive remover. Alternate stretching the OxySpur dressing and removal of adhesive until the dressing has been fully released from the skin. Use the pad under the dressing to assist in removing the adhesive slowly, releasing it from the skin. Remove and dispose of the dressing. If a new dressing is needed, clean the wound and peri-wound area and follow instructions to reapply. Have a question? Don't hesitate to reach out to your local representative or clinical team member at EO2. We wish you speedy healing, and we are here to assist you.